It's exactly 12 after 12. I do hope you're enjoying my company this morning right here on the Mid-Morning Talk on Salam Media. Next, we're going to be talking chiropractics. And let me just tell you that from here on, inshallah, we'll be having a medical segment on the show. So every week we will try and cover a different module or a different issue around health and well-being. Today, we're going to unpack chiropractics, and we're talking with Dr. Saisha Naransammy, who completed her MA in chiropractics at the University of Johannesburg, and she has so much more to tell us about this modality. Dr. Saisha Naransammy, good morning. Welcome to the program, and what a pleasure to have you here.
Good morning, Julie. How are you doing? Thank you so much.
Well.
Thank you so much for this opportunity to be on the platform, and good morning to all the listeners. I really appreciate this opportunity.
Well, you and I happened to meet by chance. I was taking my daily walk, and you and your mom were driving home, and you people thought I needed a lift. You people were worried about my safety, and you guys stopped to offer me a lift. I just thought that was awesome. How many people do something like that these days? And I reassured you that I do this all the time, and I'm very safe, and I live in the area. So thank you indeed for your humanity and your empathy. Thank you indeed.
Thank you.
I'm so glad we met, because I've always wanted to understand what is chiropractics. And I've always kind of wondered, is there perhaps an overlap, or how similar or dissimilar is chiropractics to physiotherapy? And do you find that the general public confuse this a lot and not quite sure when to consult with a physiotherapist or a chiropractor?
Okay, so basically the difference between chiropractic and physiotherapy is it's similar, because we do use manual therapy and electrotherapy and dry needling and so forth. But the crux of chiropractic is the spinal manipulation therapy applied to the spine and extremities and so forth. The general population, patients have always asked, what's the difference, between a chiropractor and a physio? And they always ask, are you also contracted into the hospital? So we are not. We actually belong to the private sector, actually the Allied Health Professions Council. And after we are done with our studies, we have to either go into private practice or work for someone, so as a locum. Chiropractic basically means done by hand. So it's of Greek origin. And it was founded many, many years ago in Davenport in Iowa, so in the United States, on the 18th of September. So I just want to share the story with you. The founder of chiropractic was Daniel David Palmer, and he was a self-taught healer. So he believed in electromagnetics and so forth. And he performed upper cervical manipulation to one of the janitors. His name was Harvey Lillard, and he had impaired hearing. So post-adjustment, his hearing was restored. Wow. And yes, it's a really, really awesome story. And David Daniel Palmer's son, so they call him D.D. Palmer, and the son's name is Bartlett Joshua Palmer. So he was the developer of chiropractic. So they opened up many colleges in the United States, and from there it spread its roots globally.
Okay, so you say you're not in hospitals. So how would and do medical aids, say if I'm on a medical aid and I want to consult with you, would my medical aid pay for my consult with you?
Yes, definitely. But it also comes down to which plan is the patient on. So we are contracted to Discovery, GEMS, CAMF, and so forth, even MassMart, ComCare, so the Universal Administrator. So most of the major medical aids we are contracted to.
We're going to talk a little more about chiropractics, but I just want to understand who is this lovely young lady sitting here talking to me. Now, once you completed your course at UJ, I understand that you got in you were involved with the Golden Key International Honor Society. What are they all about, and how has it shaped you as a young woman?
So when I was studying, I've always wanted that award. So the Golden Key Award basically recognizes the top 15% in a specific degree.
Wow.
So it's based on academic excellence. And it was a very overwhelming moment for me. It was surreal. I couldn't believe it. I was ecstatic. And it has really, made me believe more in myself, and also to inspire others that, nothing is impossible. You set your mind to something and you can achieve it.
So how does one then prescribe? Let's assume we've got some, students watching the interview this morning and feel that perhaps if they then associate or, get onto this platform, it's going to shape them or, give them that extra something to become very well-developed, grounded young people. What is it that they really offer? How do they help shape you as a personality, as a human being, and how does one then apply to a society like this?
So basically, you have to do well throughout your years of study. So each year you have to, so what I did when I was studying is every day I would come home and go over my work, and I would have questions the next day for the lecturer. And as friends, we'd discuss it. So certain points we were unsure of, we'd discuss it. So it's all about time management and actually putting effort. So not 100%, 110% in one's study field. And so our chiropractic course consists of theory and practicals, and we had to do well in both of them equally, because you can't not know your theory as well. And every year they recognize the academic excellence, and then from there they actually come to a decision of who is deserving of this award.
Do you apply, or does the university put forth your name?
The university puts forth your name. There's no application. Yes.
Okay. All right. Now, you've also gone on, and I know that you've been a chiropractic intern at the UJ Chiropractic Clinic, and you've been an assistant clinician. Are you still involved in that type of work, or have you moved away?
No, I have moved away. Yes.
Do you have your own practice now?
Yes, so I'm based in Constantia Kloof. It's called New Prime Health Center. So it's on Henry Potgieter Road, 3 streets behind the Builders Warehouse. So it's a multidisciplinary practice.
Okay. Now, apart from what we've covered already, I understand that you've treated cyclists at the 94.7 Cycle Challenge. You've also worked at the rehabilitation program for the Lions rugby team at Ellis Park Stadium, and as well as scholars who participated in rugby matches at KES, King Edward School.
Yes.
So, and last but not least, you've treated infants and toddlers at the Etembeni Salvation Army in Doornfontein or Doornfontein. Was this all voluntary work?
Yes, so it was voluntary work. It was also more motivation coming from the university to be exposed to different types of people, athletes, and so forth, because we work with all types of people, not only the general population, the working population. So we had to be exposed to athletes, to toddlers, to the geriatrics. So I've also done work at the old age home in Lenasia, where one of my friends and I went, and we actually created more awareness with the geriatric population, because they only know about physios, not much about chiropractors. The Lions rugby team, that was voluntary, but the other stuff that I've done, that was from the university, actually pushing us in that direction. Yes.
So you talked about the old age home and geriatrics. I'm thinking that the majority of older people suffer from some form or full-blown osteoporosis. How safe is it for them to consult with a chiropractor? Bearing in mind that their bones are very thin and very fragile. I'm wondering if it's safe for them to consult with you, and what would you actually, so let's assume an old person approaches you, they've got osteoporosis and they suffer from back pain, severe back pain, lower back pain. What are you going to do for them?
So with any consultation, it's very important to do a thorough history taking, okay, of the current situation, of what are the symptoms, how long have they had this pain for, is it acute, is it chronic, did it actually start because of an injury, or was it there all the time? We have to, so basically with the older population, there is an overlap with arthritis, your osteoarthritis and osteoporosis. So we have to be gentle in our technique, so we have to also look at the person's physique, and if they're coming in. So this morning I had a patient with a wheelchair, and she's 72 and she came all the way from Soweto and she has arthritis. So I had to be gentle with her and also the movement. So if it's an adjustment for the older patients, I do it very gently. The technique is to be very gentle, because also with osteoporosis, it is contraindicated. We can't do any harsh adjustments because of fractures. Okay. So yes, so that's how it goes.
All right. Physiotherapists work a lot with probably strained muscles. Are chiropractors working with muscles as well, or more on the skeletal structure of the patient?
So chiropractors work with the neuromusculoskeletal system, so 3 components. But I myself believe there's always a primary problem, coming from the joint, because muscle surrounds the joint and muscles will be secondary to inflammation. So just as how physios treat muscle strains and ligament sprains, chiropractors also treat those.
Okay, what sort of, and let's just give a plug to all young people, God willing, next year this time or next year, the universities will be open full time and people are wanting to embark on the university life, haven't decided yet what they're going to go, which field of study they're going to go into. What do you say to them about studying chiropractics?
I would say it's a fantastic choice, not because I'm a chiropractor, but I believe that if I love giving back to the community, and I believe that alternative therapy really works, and many people are interested in that kind of field now. So even patients, they would prefer the natural healing or the innate healing where the body has its ability to heal itself. And I would say, don't stop, continue, believe in yourself, set a goal, make those vision charts, visualize success. And if it's meant to be, it will be for you. So chiropractic is offered in 2 universities around the country. That is UJ and DUT. So, yes.
What subjects do you need to have to get into chiropractics, and how many years is the actual course at university? And are there opportunities after you've qualified or whilst you're studying where you can go and do practicals at clinics or hospitals?
Okay, so with the prerequisite of the subjects, you would need mathematics, so pure maths. You would need physical sciences, and biology is not really a requirement because you do actually do the subject in the first year. It's part of the modules in the first year. So basically those kind of subjects and the languages that are important. It takes between, they say 5 years. Okay, so it takes between 5 to 6, but it can go to 7 years. It just depends on how long your master's is, because you can't finish without doing your master's. And it also depends on your topic and your supervisor and so forth. There's unfortunately no opportunities for us to do our internship in the public sector or in the private hospitals. We have to complete it at the UJ Chiropractic Clinic, and that takes about 2 years to do.
All right, so you completed your master's, thus you are, you've got your doctorate, obviously. What was your dissertation regarding chiropractics? And it had to be solid, it had to make sense, it had to add value. Tell us a little bit about that.
Okay, so my thesis was on dry needling versus intramuscular electrical stimulation on shoulder pain. So dry needling
Oh,
with
sorry to interrupt. My producer is suffering terribly with shoulder pain. From the time I've come in, she's been complaining about shoulder pain.
Okay, so I think she'll be one of my patients then.
Okay.
Yes, so it was a very tough choice because many of the topics were taken. As the years go by, you're not allowed to use the same topic. So you had to look at previous dissertations and recommendations thereof and then actually get a topic. So I love dry needling. It's one of my first line therapies in practice, aside from the spinal manipulative therapy. And the second component was with the electrical stimulation. So it was 2 crocodile clips placed on the needle. So basically 2 therapies in one. And there were 2 groups, and both of them improved significantly, actually. Both of them were on the same wavelength. And it was done on the deltoid muscle, the shoulder muscle. It did take quite some time to write up. I wanted it to be perfect. I just wanted it to be right. And it's actually, I have a copy here at practice. So it does take some time with the procedure of the topic and then getting it approved at the meeting and then writing up your proposal and then your dissertation and your stats and so forth. But UJ is actually quite nice where they provide the statistical analysis. So we would go to the statistician at UJ at Auckland Park and we would submit our results and they would interpret it for us. And then we have our statistics chapters.
I have had the experience of dry needling when I've been to a physio. But in closing then, what do you want to say to the general public about a chiropractor, when to visit a chiropractor? When do you know that it has or hasn't worked for you?
Okay, I would say if someone suffers from chronic pain, extremity pain, lower back pain, neck pain, poor posture as well. So I would say don't leave it, even arthritic patients. So your geriatrics, I would say maybe from 50 onwards and then later on into like 70, 80. I have seen patients over 80. So it's very important not to leave it. And also it doesn't just get better in one session. It takes a few sessions. So everyone's body is different. Healing takes place at different times. So if it doesn't work within 3 sessions, this is how I always do it. I would then go for the next line of investigation, which would be an X-ray of either the lumbar spine or the C-spine or the neck, the C-spine, and then I would wait for the results and take it from there. So I would think it is important. Also for maintenance, I would say, go once a month, go once in 2 months.
Are there ever situations where things are just not getting better with your patient? You then need to refer them onto another medical professional, perhaps I'm trying to think of an orthopedic surgeon, for example.
Yes. So there are times when it happens and then as a chiropractor, you think, oh no, why are my treatments not working? What do I need to do? So I do change it up. So sometimes dry needling doesn't agree or go well with certain patients. Then I have to use another form of therapy. I had a patient once that came in with a walking stick and he was just not getting better. And I did all the necessary tests and I referred him off to the neurologist. Okay, and then from there, they would see, okay, does this patient need a lumbar discectomy or a lumbar laminectomy to decrease pressure of those nerves? We also have to know our vascular, the vascular aspect, because a peripheral arterial disease can also mimic the calf pain, the back pain, and so forth. So we have to do extensive examinations.
And that's where the neurologist comes in.
Yes, so neurologist, orthopedic surgeon, neurosurgeon, yes.
Okay, brilliant. So then in closing, I'm just kind of wondering, you say that it takes several sessions and you do, when you feel things are not working out, you would refer them on. Do you ever have come back after they've been treated by other medical professionals? Would you find that those patients would then come back again in terms of something else flaring up?
Yes, definitely for like post-operative treatment or even maintenance, they would definitely come back and say, I need an adjustment, or I need some dry needling done. The operation was a success. It does take long for healing and so forth. So they do come back.
Okay, what do you want to leave our listeners with, an important message as far as chiropractic is concerned?
Okay, so I would say that the general population needs to eliminate text neck. So we're all often on our phones like this, and this causes a lot of strain on our neck and shoulders. And I've seen it everywhere in malls, in restaurants. So I would tell the public to refrain from doing that, okay, and rather hold the phone up and type. Also, that we shouldn't take our health for granted. The time is to do it now. So if you're sitting hunched or slouched, the time is to fix it now, not tomorrow. And stretches are very important as well. So for people that are working from home, it's not ideal because of the ergonomics, the chairs and the tables. So I would say modify all of that. Get a stand or put some books under the laptop to make it at eye level. Put a pillow at the back so you're taking pressure off the entire back. Take frequent breaks. Hydrate. Look after yourself. Take your vitamins and your supplements like your omegas and your glucosamine and MSM. And just eliminate all bad habits, sleeping on the tummy and things like that.
Difficult one, but anyway, it was wonderful talking to you, Dr. Saisha Naransammy. Give us a phone number. How do people get in touch with you?
Okay, so thank you so much once again for the opportunity. I really enjoyed it. So my work number is 068 364
364
3245.
3245. And just remind us about the name of the medical center that you practice from.
It's called New Prime Health Center.
Okay, I'm going to look out for it the next time I'm in the area. New Prime Health Center, and it's close to Builders Hardware, you said.
Yes, and then I also have a Facebook page called Saisha Chiropractic and an Instagram page with the same name. And you'll find me on Google, so...
Oh, there you go. Yes. Covered all the bases. Thank you indeed for talking with us. We now understand a little more about chiropractics and know that there is an amazing professional like you around. So hopefully people will be consulting with you. Thank you indeed for your time. Go well, and please continue healing the people.
Thank you so much, Julie, and take care, stay blessed, and have a wonderful day further.
Thank you indeed. And let's go for an ad break before we are joined by Master NLP Coach, and that is my dear friend Khalid Jasset.